Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, policy, and practice. Each month, we select an article to feature as a press release with an accompanying podcast. And today's podcast article can be read in full at www.jneb.org for free for the next 3 months. So today I'm speaking with Dr. MacMillan Uribe, who is the corresponding author for the article titled Diet Quality of Community Cafe Meals Amongst Guests with Food Insecurity. I'm really glad to have you with us today, Lexi.
Yeah, really happy to be here. Thank you so much.
Sure. And can you tell us a little bit about yourself?
Sure. My name is Lexi MacMillan Uribe. I'm an assistant professor of healthy living at the Texas A&M Institute for Advancing Health Through Agriculture. And my research focuses on programs that address food and nutrition security among vulnerable populations and their impact on chronic disease prevention as well.
Right. And I will also mention that Lexi is one of our mentored editors at the journal. So an extra special glad to have you with us.
Yes, it's been a great run. I'm so happy, but at the same time a little forlorn that it's almost over.
Don't worry, we're not going to forget about you, Lexi.
Yes.
We have things planned.
Good.
So can you give us an overview of the paper, including what you did and some of your results?
Absolutely. So this research was done on community cafes. So for anyone who isn't familiar with community cafes, these are nonprofit restaurants that use a pay-what-you-can system. And so anyone can come into the cafe, sit down, and pay whatever they can for a meal. So this could be nothing. This could be what they think the meal is worth, or what they think the meal is worth plus a little more beyond that. And so these types of charitable food programs rely a lot on volunteerism, and they aim to address food insecurity in communities and try to foster community where they are. And so for this study, I've been particularly interested in how cafes can address diet quality among individuals with food insecurity, because individuals with food insecurity do have lower diet quality. They face greater barriers to accessing healthy foods. And so I saw a lot of potential and was quite intrigued by this cafe model in its potential to improve diet quality among individuals with food insecurity. And so this is preliminary research to inform a larger study, and the purpose was to just compare the diet quality of a meal that someone ate at the cafe, and then compare that to equivalent meal that they ate the day before. So the equivalent meal being, if they had breakfast at the cafe, then we would ask them what they had for breakfast the day before. And so then from those dietary recalls for the meals, we calculated the healthy eating index scores, so how closely they aligned with the dietary guidelines for Americans, both the total score as well as the component score. And we compared the two meals, how they fared in terms of diet quality. And we found that the cafe had significantly higher HEI score for total score, as well as some component scores. The component scores were total vegetables, total fruits, whole fruits, and refined grains, when compared to the equivalent meal that they hadn't had at the cafe. And a really interesting finding from this was that we also stratified the analysis to compare between participants who had low or marginal food security to those who had very low food security. And we found that the difference between the two meals, the cafe and the comparison meal, were much more pronounced for the individuals with very low food security. So their total HEI score remained significant when it was stratified by the food insecurity categories, as well as for the component scores too. And so the difference in HEI score, going back to thinking about the whole group, the whole sample, it was a difference of about 12 points. And I'll remind the listeners that that's a pretty substantial difference. And looking at the literature, while clinical significance hasn't been established for the HEI score, there is evidence that about 6 points, 6 to 9 points, I believe, is clinically significant for decreasing risk of cardiovascular disease. And so a 12-point difference between meals is pretty compelling when it comes to this CAFE model.
I should say so. That is very compelling. And I think this has been a great step in the right direction in terms of learning more about community cafes and their impact in with populations with food insecurity. We were talking a little bit before the podcast about how many different factors go into the success of a community cafe. And you mentioned that you also received comments in the past that the community cafe model has been tried and failed. Can you just talk a little bit about the evidence, or is there evidence that will be that this will be a sustainable solution to addressing food and nutrition insecurity?
Yeah, I'm really interested in finding out that exact answer, and I think that the cafes hold a lot of promise. So I would say that certainly there have been a lot of high-profile, not a lot, but there have been some high-profile cases of pay what you can restaurants that have appeared unsuccessful. For example, Panera, they did a Panera Cares program. So this was a pay what you can Panera basically. And so they did face a number of challenges, and their restaurants apparently seemingly closed, but and that was largely publicized. That was what you were seeing in the articles, that they had a lot of challenges and they closed. But in fact, what was then really highlighted in these articles was that those Panera Cares were meant to have closed down. They were actually Paneras. They were originally Paneras that were going to close anyway. And to finish out the lease, the Panera decided that they would do a pay what you can model as part of their philanthropic efforts. So unfortunately, it seemed more like it was a model that was failing rather than something that they were just using to carry out the rest of the lease on some Panera restaurants. And so I think that that's something if someone Googles a cafe, just something to keep in mind when you're looking at the model. There have been a lot of successes too. So the cafes that I work with are part of the One World Everybody Eats organization that supports cafes that are trying to start up, as well as existing cafes. And so, like I was telling you before we started recording, one of the defining features of One World Everybody Eats cafes are that they follow 7 core principles. And so this includes incorporating fresh, local, healthy foods into their meals, and is one of the reasons why I was interested and saw the potential in this model to help increase diet quality in individuals who are food insecure. And it also, other principles include things like volunteerism, putting social goals ahead of profits, and creating space for community. So it could be that by following these 7 core principles and having the support of the organization, these types of these community cafes can be more successful, because the cafes that have been or current members or have been members of One World Everybody Eats have been relatively successful. For example, Same Cafe in Colorado, probably one of the original community cafes in the US. It's been open since 2006. Taste Community Restaurant in Texas, they've been open since 2017, and they're actually opening a second location in Arlington, Texas this year. So there's certainly a lot of people that have struggled and faced challenges. And like any charitable food program, this model isn't without its challenges. But I think that if we see benefits like improving diet quality at the rate that it did, I think that this might be a model that's worth supporting, much like we support other charitable food programs like food pantries or soup kitchens. They often rely on federal support, grants, volunteerism, and cafes aren't that much different, except they don't qualify for federal support. And so if we are able to find enough evidence that they have benefits on diet quality, and even beyond that, maybe with community connectedness as well, and showing some other health benefits, I think that this could be a model that's very much worth supporting.
Well, it's certainly nice to hear that there are other cafes that are starting up too, so that there are some that are established and ones that are coming, which is a good sign. So as you mentioned, you showed some significant improvements in diet quality among those with food insecurity. So tell us, what are your next steps in testing this model?
Yeah, so I'm quite excited about the work that I've been doing in the space. And so I've been working on some proposals. First, trying to probably do more observational research, but employ rigorous design when it comes to observational research to see the influence of the cafe on diet quality as well as food and nutrition security over time. So if new guests with food insecurity, if they start going to the cafe, can we see changes in their overall diet quality over time? It actually makes me think of another piece of this study was one thing that we saw among the sample was that they frequently went to the cafes. Most of the participants were going at least once a week, and many were going almost every day that the cafe was open. And so if we are seeing improved diet quality with these cafe meals, we could have a pretty big impact on overall diet quality if people are going to the cafe quite frequently. And so in looking at those changes over time, I think that would be quite interesting and would add to the evidence base as to whether cafes are a strong model or a beneficial model when it comes to diet quality, and other things like food and nutrition security that I'm interested in. Also, another area that we're starting to explore and we're starting to work with a cafe is to incorporate more nutrition education and counseling into the cafe experience. So again, thinking about the findings, we did see that it improved the diet quality in the meals, but diet quality was still relatively low. There was still a little room for improvement. And so thinking about ways to increase, working with this particular cafe, we're looking at ways to create opportunities to provide nutrition counseling and support that would be available to community cafe guests, as well as they have a culinary apprenticeship program. And so individuals who are part of that program as well would be able to receive those services. So we hypothesize that the people who take advantage of this program would have improved diet quality and make healthier choices at the cafe and outside of the cafe too.
Sounds like you've got your work cut out for you. when it comes to your next steps here and a nice trajectory of research questions and better understanding this model. And I appreciate so much that you're here talking with me. Is there anyone else or anything else you'd like to add?
Yeah, I just wanted to, before we close out, I would really just like to give some shout outs and thank yous to people that have supported this work. Research is really, research really can't be done without, your village, your team. And so I just wanted to thank my co-authors, Lori Borchers. She's at Texas Christian University, and she's been a really fantastic collaborator and has done work and knows much more about the cafes than I do. So it's been really great to get her insight and experience with the cafes, as well as my colleagues from Texas A&M, Jacob Shasholsky, Rebecca Segan-Fowler, and my program manager, Erica Largacha. I cannot operate without her. And then thank you to Heather Eicher Miller at Purdue too for her insight and support in this work. And of course, thank you so much to my community partners and those who were willing to participate in this work. We hope that the science will help push forward programs that can benefit those people that are willing to participate in the work, as well as community members that are facing food insecurity.
Right. Well, that's quite a team you've got there. Thanks again, Lexi. Sure, I really enjoyed this. And to all of our listeners, remember, you can read this article in full at www.jneb.org for free for the next 3 months.